student nurse today. Can I get your name and date of birth?
Kyle Greenwald, November 29th, 2002.
Can I see your wristband?
Yeah.
Okay. I'm going to ask you a few questions to start off. Can you tell me where you are today?
I'm at my house.
Can you tell me who the current president is?
Donald Trump.
Can you tell me what day it is?
It is Saturday.
And can you tell me what holiday we just had?
The 4th of July.
Okay, my patient is awake, alert, and oriented ×4. Speech is clear, affect is appropriate. He can follow commands because he showed me his wristband. His appearance appears appropriate. He appears to be the stated age on his wristband. No odor, his hygiene is appropriate. Skin color is appropriate for race. His body structure and positioning is appropriate. He's able to hold himself up in the chair. His movements are fluid and coordinated. They don't appear to be unintentional. His behavior and mental status is calm, and he doesn't seem to be in any kind of distress. Okay, now I'm just going to shine this light in your eyes to assess your pupils, and I want you to stare straight ahead. Okay. And then if you could follow this all the way to your nose. Okay. My patient's pupils were equal, round, reactive to light, and accommodate. They were about 2 millimeters, and his sclera is white and moist. His face is symmetrical. Are you having any trouble hearing or seeing me today? Do you wear hearing aids or glasses?
No.
Do you wear dentures? Okay. Now I'm just going to check your nose, so if I can have you look up, I'm going to shine this light. Okay? And then I'm going to have you open your mouth, stick your tongue out and say, ah. Stick your tongue out. And move it left to right. Okay? And now I'm going to check the patency of your nose, so if you could close one nostril and breathe through the other. And then the other side. Good. My patient's nose is patent, pink and moist. His oral cavity was intact, pink and moist, no lesions or missing teeth. And then also, again, his sclera was white and moist. Moving on to cardiac, I'm going to first assess that his radial pulses are equal. So I'm going to grab your wrists, and I'm just going to feel, let me know if I'm hurting you. Okay. Radial pulses equal bilaterally +2, and rhythm was regular. Now I'm going to check pedal pulse, so I'm going to check your feet. You could bring your legs back into the camera. I'm going to feel for the pulse as well down here. Okay. Pedal pulse equal bilaterally +2, and rhythm was regular. And while I'm down here, I'm going to check capillary refill. I'm just going to squeeze your toes to check the color return. And then I'll do the other foot. Okay, and then I'll do your hands as well. Okay. Okay, capillary refill was less than 3 seconds, and in the legs and the hands. Now I'm just going to assess your pulse for a full minute, okay? Let me know if I'm hurting you. Pulse was 62, respirations were 18, and the rhythm was regular. And then now I'm just gonna listen to your heart. This would be done on the bare skin in a real patient, but for the purpose of the video, he's gonna keep his shirt on. All right, so I'm gonna start with aortic, pulmonic, Erb's point, tricuspid, mitral. S1, S2 noted, and now I'm going to flip it to the bell side and listen for murmurs. Aortic, pulmonic, ribs point, tricuspid, and mitral. S1, S2 noted, no extra sounds or murmurs heard, and then I would also be taking his blood pressure. Now we're going to move on to respiratory. So again, his respirations were 18, no use of accessory muscles. He has symmetrical chest expansion, and then if he was on oxygen, I would note that the delivery type and the flow rate, but he's not. And then I would check his O2 sat, and we'll just say 99. He has no chest tubes or endotracheal tubes. And now I'm just going to listen to your lungs. I'll listen anteriorly, posteriorly, and laterally. So every time you feel my stethoscope, take a deep breath, okay? Okay, the lungs sounded clear anteriorly. Now I'm going to do it laterally, so I'm going to have you lift up your arm and take a deep breath. And then we'll do the other side. Okay, are you able to lean forward? Okay, we're going to do 6 points on the back as well. Go ahead. Remember, going in a zigzag fashion still. Two more. One more. Okay, you can go ahead and lean back. No adventitious sounds heard. The sounds were clear. Again, no tubes or drains. And that's that for respiratory. And then I'm going to move on to abdominal. So he is sitting in a chair, but in reality he would be laying down, and I would assess from eye level to see if it's distended or flat. We'll just say the abdomen appears to be flat, skin is intact, appropriate color, no wounds. And then now I'm just going to auscultate first, because we don't want to palpate first to initiate peristalsis. That wasn't there before. So I'm going to go from the right lower quadrant, right upper, left upper, and left lower. And in reality, I'd probably be listening for about 20 seconds just to make sure that all those sounds are present. So that sounds present in all 4 quadrants, and now I'm just going to palpate. Let me know if you feel any pain or tenderness. Tenderness? Okay. And when was your last bowel movement?
This morning.
Okay. Did you have any symptoms of nausea, vomiting, diarrhea, or constipation recently?
No.
Okay. Have you been urinating?
Yeah.
And what's the color and the clarity of it?
Like clearish yellow.
Okay. So that concludes the abdomen. There's no tubes or drains on the abdomen as well. So now we're going to move on to musculoskeletal. I would ask my patient if they used any assisted devices, and then if they were able, I would assess their gait. Maybe, usually when I don't tell them I'm assessing their gait, so I'll have an accurate description of how they ambulate. But do you use any assisted devices when you're walking? Okay. And now can I have you squeeze my hands? Okay, strength was equal bilaterally +5. And then again, he's sitting, but if he was laying, I would perform pedal pushes and pulls. So that's that for musculoskeletal. And now I'm going to assess his skin. So his color is appropriate. Once again, doesn't appear to be any edema, but I am going to check. Just pinching lightly, assessing if there's fluid retention. And this would be all done on the bare skin as well. Okay, no edema, and then I'll check his temperature. Okay, it is warm, dry. The skin is intact, no wounds, tubes, or drains anywhere. Are there any wounds I should know about?
No.
Okay. And then I'll just assess one more time to see if there's any central lines, peripheral lines, or any IVs that I may have missed, and I don't see any. So that concludes the assessment. Thank you, Kyle.
Of course.